Here's a health headline that caught our eye. It's a device that many people with diabetes use every single day. And now those who don't have the disease are also using it to try and improve their health. A new article in the Wall Street Journal highlights one columnist's experience using a glucose monitor as somebody without diabetes. This is becoming a popular trend in health and wellness communities. The Food and Drug Administration cleared the way for the first over-the-counter continuous glucose monitor last March, making it easy for non-diabetics to use. The Stelo Glucose Biosensor system uses a wearable sensor that sends glucose data straight to your smartphone app. Here now with us is Dr. Minisha Sood. She's board certified in endocrinology, diabetes, bone metabolism, and obesity medicine. Doctor, good morning to you. Thanks for hopping on with me. You know, for those who love health data, I feel like they're going to see this as, gosh, this is the next best thing, right? Do you like this for someone who's not diabetic, or is this overkill?
I think it can be a great tool for many people without diabetes to just track their health and see how certain foods and behaviors or sleep or lack thereof may help track their glucose numbers. The issue is that sometimes it can create health anxiety, especially for those who tend to lean towards health anxiety in the first place.
Yeah, and so for those folks, you're actually talking to me when you say that. It's the reason I don't have a Whoop band or an Oura ring, because I feel like if I woke up in the morning and saw low numbers, it would just derail me for the rest of the day, right? So what do you tell folks like me who have that exact same thought about anxiety? Not worth it?
Well, I tell them to zoom out a bit. So if we're tackling the big hurdles regarding health optimization, like sleep, exercise, overall nutrition, keeping sort of what I like to call an 80-20 rule, 80% on point, 20% for the other bucket, mental health being addressed. And then if we want to add layers of extra health optimization, I think this is a great tool. I might have patients try it for a week or two at a time, certainly not a continuous commitment. And we go over very closely what the optimal glucose level should be, and I give them some rules to follow. For example, if a blood sugar spikes, it's not completely unnatural or something to get scared about. We give them parameters, and then we help them track and analyze, and then we take a break.
Yeah, dip your toe in the water to try it out first. This is also the latest thing like Ozempic, right? That's meant for diabetes, and then you have a lot of people using it who aren't diabetic. They use it for other reasons. Does this cause any sort of supply shortage that you're worried about here with these devices?
No, I think the companies that make these devices are anticipating the widespread use, and they're hoping for it, probably. I think what it highlights is that by the time someone has type 2 diabetes, which is the main diabetes that we speak of when we talk about diabetes, they've had insulin resistance or even prediabetes for the preceding 5 to 15 years. So I think that it's not entirely premature for people to be concerned or at least aware about their blood glucose levels very early on. And if they take a 2-week sample and they see that there's not really an issue, then no love lost. I think that's useful information. And I think it might be really eye-opening for those who might be on the insulin-resistant or prediabetes spectrum, who can maybe save themselves years of progressing towards type 2 diabetes.
Yeah, well, it's fascinating to know about, and never hurts, I guess, to have another tool in your arsenal when it comes to our health. Dr. Minisha Sood, thank you so much for your time this morning, ma'am. Appreciate it.
Thank you so much.
Have a great day.
Thank you for watching. Subscribe below and download our NewsNation app right now on your phone, and you will get fact-based, unbiased news for all Americans.